I want to take a minute to bring attention to a group of workers that are also essential, but have been at a higher risk of getting hurt or getting sick at work. And those workers are migrant workers. Migrant workers have been coming to Canada for over 50 years. Migrant workers live here, they work here, they pay taxes just like everyone else, the same tax dollars that pay to fix our roads, provide us access to health care, for schools, social services, but they don't have access to those things that they pay into. Migrant workers have very little rights and protections in Canada. There is very little to no accountability when enforcing health and safety protection on the farms or in the bunkhouses. When workers get injured on the job, employers want to send them home before proper medical attention. Once they are home, they can't work in their home countries, they can't provide for their families, and on top of that, a lot of times they are paying for medical expenses out of their own pocket for injuries or illnesses that happened here while they were working in Canada. Sometimes, I would say most of the time, these injuries or illnesses could have been prevented if their employer provided proper training, given them safety equipment, not used harsh toxic chemicals, and this list goes on. Last year, right here at a local farm, limestone was being used in the greenhouses. A lot of the workers started to feel sick. Their eyes were burning, their throats were burning, they had rashes on their skin, they were feeling chest pain, and the workers told the employer all of this and nothing was done. And one day, the workers just could not take the pain anymore, and everyone stopped working and asked the employer to stop using limestone. And the employer did. But because of that action, it resulted in many of the guys not being able to return back to work in Canada. A few months after this happened, management at this greenhouse spread even more limestone. This is just one example of what happens to workers that try to speak up.
June 1st, 2021 is the 38th Injured Workers Day. Like last year, because of COVID-19, we are not gathering in person, but we are still together in our resolve to protect workers and to ensure when someone is injured on the job, they are financially, emotionally, and physically supported. Over the last 15 months, the world has been different than we have ever known it to be. While our governments begin to lift restrictions and slowly return things to normal, we must remind them that normal is not good enough. Ontario's health and safety and workers' compensation systems are broken, and we must do better. This June 1st, we stand together and push for a better future. We know what is needed to fix the system. Workers must be protected on the job. Those who do get sick must be covered by workers' compensation without hassle or delay. And the Compensation Board must end their harmful practice of deeming. Over the last 15 months, many Ontarians have been working from home, but countless others have been putting themselves at risk of contracting COVID-19, a disease we don't know the long-term effects of, in order to provide the rest of us with essential goods and services. Working tirelessly to keep us safe, healthy, and fed. Mandatory inspections of workplaces are necessary to determine if all health and safety regulations are being followed. And if they aren't, there needs to be much stronger, more stringent enforcement measures. These inspections cannot be done by telephone or on the honor system. We know there are employers who will put their interests before their employees' health and safety and bend or break the rules. If an essential worker develops COVID-19 during this pandemic, it is common sense to presume that they contracted the disease in the course of their employment. Instead, the Compensation Board is handling everything on a case-by-case basis, leading to an enormous backlog that is leaving thousands of sick Ontarians waiting weeks or months to know if they will receive the benefits they should be legally entitled to when they get sick. 15 months into this pandemic, WSIB's COVID policy means workers from nursing homes and hospitals are still having their claims rejected. NDP Bill 191, tabled in 2020, would force WSIB to presume an essential worker who contracted COVID-19 did so on the job, ensuring they can't be denied benefits. For many workers who were permanently injured before COVID-19, the WSIB engages in a practice called deeming. The WSIB assigns these workers with phantom jobs and reduces or eliminates their legal benefits by the amount of money the board simply guesses a worker could earn in this job, whether they are able to get that job or not. The statistics on the number of these people who are not working and the poverty this policy creates are frightening. To this day, the Compensation Board continues to pretend that those with work-acquired disabilities and suppressed immune systems can walk out their front door into a pandemic and an unprecedented economic crisis and get a full-time job. It's time to consign this policy to the dustbin of history. NDP Bill 119, tabled in 2019, would end the practice of deeming. So as the province begins to open up, we tell the Ford government and the Compensation Board, we don't want to go back to normal. Normal is not good enough. We must do better. This Injured Workers' Day, it is time to create meaningful change to keep workers safe and to show once and for all that workers' comp is a right.
Hi there, sisters and brothers. My name is Matthew Osherwood, and I'm the board president for the Windsor Occupational Health Information Service. Today I bring greetings from the Windsor Occupational Health Information Service and the Occupational Health Clinic for Ontario Workers. And for over 25 years, the Occupational Health Clinic for Ontario Workers have provided free services working with thousands of workers with long-term health effects, from exposures at work, whether it be musculoskeletal disorders, noise-induced hearing loss, chemical exposures, mineral exposures such as asbestos and celiac. And with their medical teams, occupational hygienists, and ergonomicists, they also work with joint health and safety committees in all workplaces across this province to help make their jobs safer and healthier. Our organizations are proud to be here in this great community, working together for nearly 3 decades, helping provide workers and their families a better understanding of the workplace hazards and to prevent occupational disease and injury. All too much we hear about workers getting hurt or killed in the workplace, and this needs to stop. We have to stand up for workers' rights in the workplace. Education and for workers and management alike is key. That's what we do at WOHIS. One of the many things we do as a nonprofit is go into schools and educate high school students about their rights and responsibilities in the workplace. This has a huge impact on their young minds and stops them from being taken advantage of when they enter the workforce. As some of you may know, we also have an online and physical library ran by our executive director, Larry Gerard. Please feel free to contact Larry if you have any questions. I'd also like to give a huge shout out to all of the frontline workers, whether it be the police, fire, grocery workers, the nurses, anybody that's worked during this whole pandemic. A strong thank you. And please know that your hard work doesn't go unnoticed.
Hello and welcome. Our mission is to protect workers and their communities from occupational diseases, injuries, and illnesses, as well as support their capacity to address occupational hazards and promote social, mental, and physical well-being of both workers and their families. We invite you to continue watching this video and to click on the PDFs available below to see more detailed information about OCAL's free services, and also check out our very resourceful website.
Is mental health an issue in the workplace? Yes, it is. 1 in 5 Canadians experience a mental health problem or illness each year. 70% of Canadian employees are concerned about the psychological health and safety of their workplace. 30% of short-term and long-term disability claims in Canada are attributed to mental health problems and illnesses. This costs several billion dollars annually. So why deal with workplace mental health? Employers and employees both benefit from a psychologically healthy workplace. Employees have improved engagement, increased morale and satisfaction, retention and recruitment of employees increases, as well as their productivity. On the other side, it reduces absenteeism, reduces grievances and healthcare costs, and it also reduces medical leave and disability and workplace injuries. So how can workplace mental health be evaluated? OCAL has developed a free, evidence-based online tool called Stress Assess. It's designed for workers and managers who are interested in assessing psychosocial hazards in the workplace. There's both a personal and a workplace edition. Upon completion of the survey, resources are provided to give the workplace ideas on how to address identified concerns. It's anonymous, collective, and confidential. For further information on Stress Assess, please visit www.stressassess.ca or contact your local OCAL representative.
Regional risk tool and tips. Escalating advice based on your region's COVID-19 infection experience. And the tips are divided into 7 categories: communicating, cleaning, hand washing, ventilating, distancing, screening, and masking. And here we see the graph, which shows the different regions. Right now I'm only showing Brant County. If I add Chatham-Kent, you can see their numbers, and if you hover over a particular point, you can see the numbers. The idea is that you find your public health region, click on it in the list and show it, and then see what color band your region is in. And based on that band color, you go through the 7 COVID tip topics and make sure you're doing what you need to prevent infection. Now we also have the regional risk table at a glance, where we have all the public health unit regions listed. And you can see that today, Ontario, Ottawa, Guelph, and Toronto are at the highest level of risk in the list. And you can see that Brant, which we showed earlier, is at a minimal risk. So then we go through the tips, the prevention tips, and they're all color coded. So if you're in the blues band of risk, then you do everything that's in blue. If you're in green, you do everything in blue and the green, etc. And you do that for communicating, cleaning, disinfecting, hand washing, ventilating, distancing, screening, and finally face covering and masking.
Is your cell phone hurting you? Well, it doesn't have to. New technologies such as cell phones, tablets, and laptop computers can lead to musculoskeletal disorders in multiple areas of the body, such as the shoulder, wrist, elbow, upper back, lower back, and the neck. One of the most common musculoskeletal disorders due to cell phone usage is referred to as text neck. The average human head weighs between 10 and 12 pounds. 45 degrees is the typical angle of the neck while texting. Holding the head at this angle increases the force on the neck from 12 pounds all the way up to 49 pounds. Prolonged time spent in these postures can lead to damage of the structures and tissues of the neck and shoulders. So what can we do about this? Well, there are solutions that we can implement while using our cell phone. We can use the Bluetooth feature, we can use earbuds. We can simply bring the phone up to eye level instead of having to bend your head forward. We can use the voice-activated features more often. We can perform neck and shoulder exercises. But most importantly, we can and we should be taking breaks from utilizing our cell phone. For further information on new technology solutions for your workplace, contact one of our ergonomists at OCal.
Here's what it looks like when you open it. There's a list of the 12 hazards, and then for each one you do a rating. And how well are dangerous chemicals handled? So I thought I'd apply it to my office, and in my office I have asbestos, paraformaldehyde, hydrogen chloride, and an industrial strength cleaner. And you know, the typical response if you have a problem at the bottom of the hierarchy of controls is wear a mask. So here's a picture I took and with my circles and arrows, and here's also a picture of the asbestos. Notice it's in a plastic bag. I use it for demonstrations. And the wear a mask, so there I am sitting at my desk with a mask. And health and safety, you can use the pictures for different things. So I noticed that when I looked at the picture, my desk looked cluttered. I never noticed that. So I can use the same picture again. Then in the end, you get a result. Each are color-coded to the level of concern that you have. And there's the scale that it's interpreted. But if you click on each one, you get some ideas on how to address those hazards. And also, you can send an email. So you generate a PDF report, and that can be attached to an email sent to my supervisor. And
that's just out of your office.
and there are also additional resources. So if you click on the link, you go to some resources like here for chemicals or for health and safety hazards.
It's important to know how to properly adjust your seat to reduce lower back problems. For adjusting seat distance, ensure the proper distance is achieved to allow yourself to sit comfortably with your knees between 90 and 110 degrees. If the seat is too far back, it can lead to slouching of the lower back, and if too far forward, can result in a reduction of blood flow and nerve supply into the lower legs. After the seat has been properly positioned, the steering wheel is next. By depressing a lever on the floor with your foot, you can move the wheel further or closer to your body. Position the wheel so it is located to avoid reaching away from your body when steering or having to lean forward when driving. To prevent the seat from bottoming out when in motion, it is important to set the seat tension to that of the worker. The tension ranges from 50 kilograms or 110 pounds to 130 kilograms or 287 pounds. This is done by depressing the gray lever at the back of the seat.
Hello again. We would like to thank you for participating in OCal's virtual booth. We hope that it was a valuable experience, and we want to remind you to please also check out our website for more resources and information on upcoming events. Thank you and have a healthy day.